If you suffer from lower back pain, you're not alone. It is one of the most common reasons people see a doctor. For the last 10 years, Connecticut Disc and Laser Therapy Centers has taken the approach of treating the root of the problem instead of just treating the symptom. Dr. James Delfino is president and director of Connecticut Disc and Laser Therapy Centers in Shelton. He is also the author of the book, Non-Surgical Solutions for Today's Chronic Conditions. Great to have you back with us, Dr. Delfino.
Great to be back as always.
Let's talk more about what Connecticut Disc and Laser Therapy Centers is all about.
Sure. The practice was founded back in about 2003, and the focus is about non-surgical solutions to today's chronic conditions, which are really not finding results from a more conventional standpoint, such as physical therapy, medications, injections, which, if we're looking at the news now, we're seeing a big epidemic with meningitis and surgery. So what we're doing is we're trying to focus on the ability to find answers to really chronic conditions that are not benefiting from those types of approaches.
Is this a pretty unique approach?
Well, the approach that we use is usually a two-part approach, and it involves, for lower back pain, non-surgical spinal decompression and therapeutic laser.
Lower back pain, how prevalent is this?
Well, it's the most common reason why patients are going to the doctor. It accounts for more doctor's visits than any other condition that is shown in the industry.
So how does that happen? Is it that the disc is deteriorating?
Well, what happens, if we look at the spine here, the most common problem that we tend to see is the actual disc itself, which are these shock-like absorbers, almost like sponges that are located between the vertebra. And over a course of time, whether there is a significant injury or repetitive motion, they tend to break down. And the problem with that breakdown is that the disc actually has the ability to heal on its own. So when we see this breakdown, we have to really look at it from a standpoint and say, well, why isn't it healing on its own? Medical research shows that it can, so why would we see signs that it can deteriorate?
So how do you actually treat the problem? How do you get to the root of the problem?
Sure. The root of the problem actually is the disc has a pumping ability. So when we're bending and moving and turning, we can actually see that the discs collapse and expand. Well, that's what's normal, and it's forcing water and nutrients into the disc and waste product out. Now, if some injury occurs where that's not happening, the disc is going to start to dehydrate, and that dehydration leads to a series of cracks that we tend to see on the outer side of the disc, and this leads to tears, and then we can start getting this material that's inside the disc to start to bulge outwards, and this is called a protrusion or herniation.
All right, what are some of the non-surgical options you offer?
Well, the biggest non-surgical option we offer is what's known as non-surgical spinal decompression. Obviously, there's no surgery involved, no downtime, no side effects, no contraindications. What it actually does is it recreates the pump mechanism of the disc that I had talked about before. If we get the disc healing, and we can see this from the video now, how the therapy actually occurs, we're seeing a collapsed disc in the middle of the screen. If we decompress that disc, we're bringing oxygen, nutrients, and water back into the disc cavity, essentially rebuilding and healing the disc. And if we see the video from the side now, as that disc expands, below it is where the nerve comes out. That's where the pressure is usually found. If we take the pressure off the nerve, the back pain component, the leg pain, the sciatica, the deep debilitating pain will start to alleviate and go away.
Well, how successful is this?
Well, it's very interesting because since non-surgical decompression and therapeutic laser are looking at this from a healing standpoint and not focusing on just the symptom, the success rates are astronomical. They range anywhere between 85 to 95%. And it doesn't matter if we're talking about a herniated disc that happened from a workers' comp injury last week or someone that's been suffering with chronic arthritis for 20 or 30 years. The bottom line is that we're actually looking at the cause of the problem and fixing that. And if we can get that, we're going to get the results.
What are the overall benefits for people?
Well, the overall benefits, as I talked about earlier, is that you are having a chance to avoid surgery, which really is not looking to correct anything. It's really looking at a pain management standpoint. We know the side effects with injections, and even though cortisone and epidural injections are designed to decrease That inflammation and swelling, there are byproducts and there are also some complications.
Running out a bit of time here, but let's talk about laser therapy as well.
Sure. Laser therapy is, again, also a non-invasive, non-surgical approach that we typically utilize along with our decompression program. It's a light energy treatment. It's non-invasive, non-surgical. And what's great is not only can we utilize it with the lower back, but we can actually utilize it with other conditions as well. So it's all computerized. There's over 30 to 40 pre-programmed pathological conditions in there. So if a patient comes in with arthritis of a knee, herniated discs, it doesn't matter. We actually have all the protocols set into the system, and we can actually pinpoint the specific problem, herniations, degenerative joint disease, and so forth. And then we actually utilize this laser probe, and we actually bring it over the area of injury, and it actually improves the circulation, helps to decrease inflammation and promote that healing along with decompression.
Very good. All right, we have a special offer for Connecticut-style viewers, and it's really for the first 20 callers.
It is. We usually get inundated with phone calls, and unfortunately,
I'm sure you do.
in order for me to be able to, address everybody as well as we can, we'd like to give a free evaluation for the first 20 callers that do give us a ring.
All right, so if you want more information about Connecticut Disc and Laser Therapy Centers in Shelton, all you have to do is call this number 203-922-9277 or visit ctdisccenters.com. Again, that number is there. First 20 callers, right, Dr. Delfino?
Correct.
Okay. Thanks again for being here with us.
Thank you for having me.
You're welcome. Coming up next, Taylor Greenberg gets creative with a pre-trick-or-treating dinner idea your family will love. Plus, check out this little pumpkin in the pumpkin patch. Remember, you can send your pics to Report It. She's so cute.